Hey there, and welcome back to the Complicated Kids podcast. I'm your host, Gabrielle Nicolay. I am a toddler whisperer, a parent coach, and I like to think about all things orchid kids. And so today I am delighted to have Kiley Gibbs, Dr. Gibbs. Welcome.
Thank you. I'm so excited to be here.
We're going to talk about constipation,
Yeah.
particularly in orchid kids. But before we do that, tell us a little bit about yourself and where you are and what you do.
Yeah, so I'm Kiley Gibbs. I'm a doctor of physical therapy. I'm a board certified pediatric clinical specialist in physical therapy. I completed a pediatric residency through the University of Michigan, and that's actually where I was first introduced to pediatric pelvic floor therapy. So we had a couple of therapists in office that were just starting to learn it. I observed, I saw the difference it could make in all sorts of kiddos, typically developing and otherwise, and how impactful it was for the entire family unit. So I came down here and moved down to the Maryland, Virginia area, worked at a local hospital for a little while, and then opened up my own practice in 2019, January 1st, 2019. And since then, I've been helping families either in person. Now I'm exclusively virtual, which is great. I'm able to reach a lot more families because of that, even nationwide, for different consults and second opinions and whatnot for constipation, incontinence, delayed or troubled potty training, or even pre potty training, like we had talked before. But yeah, that's what I do.
I love this. Okay, so at some point you're going to go into like, how does that work? You're working on pelvic, because I asked you the same question when we first met. Like,
Yeah.
you can work on pelvic floor on the internet.
Yeah.
um,
Yeah.
right? And I think what you explained to me, but actually let's talk about it now, is you're coaching parents through how to do this with their child. Yeah.
Yes, yes, and that's exactly what I would do in person too, because a lot of times when I was seeing kiddos, I am the last person in a slew of providers that they have seen. So
Mm-hmm.
they don't want to be touched. They don't want to be looked at. They don't want to talk to me. I would have some kiddos hide, behind the pillows on my couch or underneath the table in my room. And it got to the point where removing them from that situation became so much more impactful and beneficial to our sessions than anything else. Sometimes I say, you know what, you can go and play in this big room here. We're just going to stand right at the door and I'm going to coach your parent or talk to your mom and dad about what we're really going to do. So with virtual sessions, there's a huge intake, obviously. We have to know exactly what's going on. And then we start to uncover the layers of what's happening. So we take a deep dive into their diet preferences and what we can add to. So I don't like to take away things that kiddos are really enjoying, because so often it's like four things, right, that they're eating or enjoying.
Mm-hmm.
So we don't want to take those away, but we can add things to what they're enjoying in order to get them more fiber or get them more water, or make their food and body work together a little bit better too. So I'm coaching the parent on how to do these things, and if we need to add in some more or very specific exercises, so contracting the pelvic floor muscles, relaxing the pelvic floor muscles. When we need to do that, I coach the parents how to do that too. I show them exactly what to look for in their kiddo's body, because they're going to be more relaxed with mom or dad looking at their bottom than with me, a stranger, looking at their bottom. Now, some kiddos, wouldn't even wait until I got out of the treatment room until they were fully naked and going, okay, I'm ready. And I'm like, wait, hang on. That's not what we're doing. Take a step back and get under the covers. I'll come back in when you say you're ready. So there's a little bit of coaching involved with some kiddos who are just a little bit more free spirited than others. But most kids aren't that way, right? Most kids are very, very shy, and rightfully so, especially if they've been dealing with something like incontinence, whether it's pee or poop incontinence, or even constipation. Their body might hurt. So why would they want anyone putting their hands on them? So
It's
that to
such
say,
a
we do this hands off.
It's so good. And
Yeah.
it's actually very similar to something I started doing during the pandemic of necessity, because I couldn't
Hmm.
go into homes and schools, which was, I had a couple of kids who really did not want me in the room. And I put that in air quotes because I wasn't in the room, I was on the computer with their
Right.
parent. I was competing for
Hmm.
attention. Or they were competing for their parents' attention with me. And so it set up this really weird triangle. And so at one point I was like, you know what? I'm turning my camera off. parent, I will talk to you through a headset and let me guide you through a session of what I would do if I were there.
Mhm.
But now you're going to do it. But there are so many benefits. It started off again, like kind of a like, well, shoot, I got to make this work. But it turned into something that is very, very effective. And we call it screenless coaching, where because my screen is off, but I've got eyes on the room where I can see the child, I can see the dynamic, but the parent gets to walk through the experience and feel all of the connection and loveliness and see the progress and make the progress happen or help the progress happen, which is what I want for them because they're with their child 24/7. Right? It's one thing if, that nice lady comes in and pushes on your belly and something good happens. If I can't do that at home, me, the parent, then I'm at a loss. And now I've given away my power and there's like a whole thing, right?
Mhm. Yep,
So,
that's exactly it.
yeah.
Yeah, and I used to do that when I treated infants and toddlers through the county. I would do that too during the pandemic. You had to. And for babies, the screen is so distracting. That's all they want.
Yeah.
So I had the same result too. So, well, how do I eliminate myself but still stay in the room? So parents really become an extension of my hands. And so that's how, yeah, it's such a great way to say it, right? You are my hands. You are getting the knowledge from me. I'm telling you what to do, and you are feeling this firsthand. It really puts the parent in the driver's seat and says, you know what, I felt this. This is the way they've responded. This is working well for us, or no, this was terrible, and here's why. So it's really more powerful for parents, and there's a lot faster buy in the whole process, too.
Yeah. Okay. So that's how you do things virtually.
Mhm.
How do parents find you and why do they come to you? Like, what's a typical, like somebody calls and they say what?
Yeah, so somebody called and they say, my kiddo has been bedwetting for years. My kiddo has been having pee accidents during the day, and now it's just gotten so bad. Or we thought they would grow out of it, which is a very common one. And here's the key, they won't. Or my kiddo has always had a little bit of constipation here or there, but now we found ourselves in the ER because their belly pain was so bad, or because they didn't poop for 2 weeks. So those are really the people that find, I know, it's really sad when that happens. Those are the people that find me. Or if we're lucky, they say, oh, I saw you on Instagram and I have a kiddo who has had a little bit of constipation over the last few weeks and I'm getting ahead of it. That is
Mm.
so rare. Normally it's, is this pain point painful enough until they find treatment?
Well, and what's interesting about that, I was thinking about this the other day because I was having some diet shifts and things were backing up on me. And I was remembering this time when when my oldest was 4 and we had traveled. So trigger, right?
Mm-hmm.
He hadn't pooped in 4 days, but the way that I realized that he hadn't pooped in 4 days, because I wasn't tracking it, because he generally wasn't constipated, which is a little bit different. I can totally appreciate that. That's different from some of the parents who are listening to this, but
Mm-hmm.
he was behaving so abominably.
Yeah.
It's like, what is wrong with you? I wasn't saying this out loud. But in my head, I was like, what is happening?
Mm-hmm.
And then he pooped and his behavior changed on a dime. So
Instantly.
I say all that to just remind, and this is something I'm saying constantly to parents, is your child's internal reality, it affects their behavior.
Oh, yes.
Right. And it's real. So the discomfort of being stopped up, of being constipated is real. And brain and body will like throw everything at that and have nothing else left for please and thank you, for
Yep.
not hitting brother, for going to soccer, whatever. Like it doesn't matter. But behavior is directly
Mm-hmm.
impacted by constipation. Yeah.
Directly, so directly. And you said it, you cannot emphasize it enough. If their body is focusing on something that is causing them distress, that is needing to happen, but is not happening, they are completely incapacitated in any other way. So we also think about it as fight or flight, right? So if they cannot respond to this signal, their body starts to heighten in the stress. Their body starts to say, well, we need to elevate this. This is too much for us. We need to get it out. And then they just get too worked up that they can't physically relax and engage that parasympathetic nervous system in order to fully relax their body, calm themselves down, and then eliminate the pee or the poop, normally the poop. So then we have this vicious cycle of them just being elevated and elevated and elevated until finally they just can't handle it, and something happens, right? That either the behavior amounts greatly or their body just releases the poop overnight when they have finally shut down, which is normally what we see. So I see a lot of parents who say, my kiddo was doing fine. They have occasionally a few days per week that they don't poop, but now all of a sudden they're only pooping during nap or as soon as they wake up from nap or as soon as they wake up from bedtime, or they're pooping overnight. And that's because they're not able to engage that relaxation in their own body and decrease that anxiety, if you will, for lack of a better term, because in some kids it doesn't present as regular anxiety as we think of it, right? They're not able to fully engage that calming sense that we need to relax our body, to evacuate our bowels. So it's amazing.
This is, yeah, and it strikes me, this is just another manifestation of
Mhm.
how some brains and bodies have this hair trigger.
Yes.
They're wired for fight, flight, or freeze. They're like at any given moment an instant away from a stress response.
Mhm.
And some kids are living there. And I think what I hear you saying is that bodies are like kind of living in this tense place
Mhm.
much of the time. And then, correct me if I'm wrong, muscles are kind of forgetting that they can be turned off.
Oh, yes. Have you ever been in the car in traffic and you are clenching the wheel so firmly? And then all of a sudden you get home, you're like, oh my goodness, I need to peel my fingers off the steering wheel. That's what their body's doing the entire time. Their muscles are doing the entire time. They have no idea how tight those muscles are until we say, you got to relax these to let the poop out. So their bodies too, and this all depends on how kiddos experience the signals from their body too, right? That interoception, that knowing and understanding and feeling of those signals and sensations from their body can be so different, is so different from person to person to person. And I always ask parents, how do you know you need to poop? They go, wow, I just poop.
You just know.
You just know. Okay, well, tap into how do you know? Do you feel pressure? Do you feel sick to your stomach? A lot of kiddos will say they have a belly ache or they feel hungry because they can't interpret those signals properly yet. And those are some of the last things to become reliable in any kiddos, are those signals and being able to understand those signals. So you've all seen the kiddos do the pee pee dance or the poo poo dance where they're shutting their legs so tight they're bouncing. Maybe they're sitting on their heels. That's a way to reinforce closure of those external sphincters and to help reinforce the pelvic floor muscles. So they don't know they're doing it. They can be doing this for hours and they have no idea because their body either is ignoring or not able to hear those signals, or their brain, I should say, is not able to hear those signals from their body, or the brain isn't understanding what those signals are meaning and saying. And so we have to keep in mind too that it's not their fault. They just have this disconnect that's happening.
That is such an excellent point. I want to go back to the term that you used, interoception,
Mhm.
one of the 8 senses, or however many we're
Mhm.
saying they are. I did an interview with Kelly Mahler, actually, who I consider to be the
Oh,
queen of
great.
interoception.
Yes.
Yeah, so you can find that on this podcast at a previous episode. But it is like the one thing that we cannot teach somebody, because it's such an internal experience.
Right.
Nobody else knows what my internal experience feels like. We can talk about it. We can say that, yeah, when you haven't pooped for 3 days, it feels really full or
Mhm.
uncomfortable, but everybody's physical experience is a little bit different. And the way that they're perceiving that experience is also different. And I think and this comes sort of across the board, is we think of children as being, I just said this on a different podcast, we think of children as being like a subclass of human because they don't know
True.
things, right?
Yeah.
And we forget to give them the benefit of the doubt of like, hey, they've never been human before. Hey, they've never been constipated before. Hey, they've never had to connect the feeling of urgency with an action because they've been babies and or wearing diapers, and because their brains are not easily wired for that, right?
Right.
And so
Right.
We forget that they don't know. They don't
Right.
know.
And it takes a lot of repetition to be able to know. So think of if you're learning a new skill, understanding the signals from your body is a skill. We have to learn it and repeat it over and over. And that's what I tell parents dealing with constipation. Just because you had 1 week of daily poops doesn't mean you're in the clear. You have to keep on repeating it, keep on repeating it. And then even when so if they're, if, for example, going from pull-ups, or I have a kiddo who's 4 right now who is trying so hard to get his pee and poop in the potty, and he's not interested. He can somewhat tell that he needs to go, but the signals are inconsistent and unreliable. He was constipated pretty severely, but not showing it. So daily pooping, but still very backed up on the x-rays, which is a whole different beast.
Pause.
Yes.
Okay.
Yes.
Say that part again. He's pooping every day, but
Yep.
he's got impacted.
So not necessarily impacted. When we say
Okay.
impacted, we think of it a blockage and like not moving.
Okay.
We think of more of an urgent situation when there's an impaction there.
Okay.
But this kiddo had a very high stool burden in his x-ray. So meaning that his colon was just full of poop. And the colon, the intestines are like a balloon. So they can stretch, but their main purpose is to contract and relax, open and close, not necessarily opening and closing, but this open close motion, if you will, almost like if you were squeezing a toothpaste tube, right? So they need to contract, relax to move all the food along. When they are so full of poop, they cannot contract to move anything along. So it just sits there. So they get backed up and backed up and backed up, and then it moves very slowly through the system. So you can still be having daily poops, sometimes even twice a day poops, and have this huge buildup of poop back in the colon. So imagine if you have 100% of poop, right? You have the X amount of poop that you need to get out every day. If you're only getting 80% of that poop out, 70% of that poop out, that little percentage backs up and backs up. And years of that going on results in a distended colon. So this kiddo, yeah, going back to his repetition, his mom's saying, well, when is he finally going to feel it? High repetition. The poops need to come every single day, kind of like clockwork. It's okay if they're not around the same time, but getting them to be around the same time is very beneficial, and getting even more poop out so his body can understand, right? This is how we move the poop. This is what it feels like when it comes out. He is now starting to feel the sensations and had 1 poop on the potty. The next week he had another poop on the potty, and then he had 2 poops on the potty. So he's trending in the right direction, but it takes high repetition. And that's where I think a lot of us get lost in the weeds, and myself included, is why isn't this progress happening quickly? And I, even as a provider, have to keep reminding myself, okay, they've been working at this for 2 or 3 months. We still have months to go because he's had this problem for years, right? So we can't expect it to resolve in weeks, even a few months. I used to hear this thing, okay, give yourself a month to heal for every year you were in a relationship after a breakup. It's pretty much the same thing with your colon. Give yourself a month to heal for every year you've been dealing with this, and then I add on 3 months as a beginner point for that. So if your kiddo has been constipated since birth and therefore, okay, 3 months is your baseline, and then add 4 more to that. That's your minimum, your minimum.
And not
minimum.
everybody is going to be on that timeline, because if we're
Correct.
dealing now with, and actually you can tell me this, if we're dealing with any kind of neurodivergence,
Yes.
so autism, ADHD, other, types, those are the big ones. Other types of developmental kinds of things. I'm sure there are genetic syndromes that come with constipation issues, toileting issues. Right now we're adding maybe more time because of the neurological component.
Yeah, absolutely. Especially because their brain is hardwired different,
Mhm.
right? So a lot of these kiddos, especially I see a lot of kiddos with ADHD, they might have sensory sensitivities. So the sensations they feel in their body, they might need a louder voice telling them that it's time to go poop. However, when that voice is loud, it can be too loud and frightening, right? So when they need to poop, it is at that very last minute, very urgent feeling is only when they feel it at first. But that can be very off putting and very scary and painful, is what they might interpret from that as well, from that strong signal. And so those kiddos end up starting to hold it in. Well, I'm not going to let that out. That's going to be so painful and that's going to be awful. So I should shut everything down and hold it in. How could I relax when that's so painful? So we get that opposite problem, right? We have two conflicting problems. They can't hear it until it's loud, and then when it's loud, it's too loud. So lots of those
That's the
issues.
like it's a like an amplifier that's got like feedback, right? When you turn
Mhm.
the microphone up loud enough to hear it, now you've got feedback and it's off-putting. So it's that same
Yeah.
experience of like the bandwidth. And I find this to be the case actually with most of the kids that I deal with, which is they've gotten a smaller bandwidth for life, for being
Yes.
in their body. They have a lower range of a smaller range of tolerance for physical experiences and
Right.
emotional experiences, quite frankly, right? Where too little is not enough, but any more than that is too much all of a sudden.
Right.
And that tracks exactly with what you're saying. I mean, it's and so just I use that kind of visual often to just have parents start to appreciate how hard it is for their child to just exist,
Hmm.
right?
Hmm.
Like that's really hard. Like imagine if you were just uncomfortable all the time and you didn't know that you aren't
Yes.
supposed to be uncomfortable.
Yes.
That's so
Yeah.
sad.
It is sad. It is sad. And I use a lot of analogies to try and help parents understand where their child is coming from, because it's very hard when you have a parent who is not neurodivergent who has a child who is neurodivergent, and sometimes it's hard to really understand what that kiddo is going through. And so if you can explain it to them, the way I do it is I say, if you're in a crowded shopping mall, picture like Christmas Eve, you're in the mall, most miserable place to be, right? Everyone's touching you, it's loud, there's music everywhere, everybody's hustling and bustling, and then you have your kiddo trying to get your attention. Mom, 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 mom. And you're trying to get something done. And all of a sudden you're like, what? That's that signal. They're trying this poop. This child is trying to get your signal, your attention, and they're being really polite at first. They're being really great. And then all of a sudden, mom, and they just yell at you. That is that signal. And then everything explodes. You leave the mall, you're done, you're just over it. That's kind of what happens to these kiddos. They just can't handle that final signal because they have very little, like you said, bandwidth to be able to hear it, and then it's too loud.
So, okay, parent comes to you, this is happening. I have a family I work with, kid only poops while he's asleep, 9:30 p.m. What do we do?
Yeah, so at first we're going to look at their diet, see what they're eating, see how much fiber they're getting. Most kiddos are not getting enough fiber. Most adults are not getting enough fiber in their diet. We are a packaged universe right now, right? So living out of packaged foods. And I do this too. I love a good on-the-go snack, but the majority of people are having too many of those. So it's not necessarily um, that these snacks are so bad for us, but the processing of these foods takes out a lot of the value in them. So we look at the diet, see where we can add things, where we can add insoluble fiber if they're constipated, because that will help it go a little faster. We look at how much water they're drinking, because if you aren't drinking enough water for your body, then there's no water left over for your poop. The body wrings it all out and the poop is dry. So as you take a sip from your water, I love it.
Cheers.
Cheers. I find myself doing the same thing. If I don't have my water bottle near me all day long, I don't drink enough water. And it should be half your body weight in ounces. So if you have a child who's 50 pounds, then 25 ounces of water is your goal. And if that has to be mixed with juice or mixed with a flavoring or mixed with whatever, go for it. But we've got to start increasing that liquid. And then what we do is we look at their habits. So we track what's happening for a few days, see what's going on, see when they're pooping, why it could be happening, and we optimize their potty posture. So for a kiddo like that who's only pooping at night, we're still going to try and maybe poop before bed, but we're going to optimize the potty posture so it doesn't feel like it's stuck. So we have one muscle in particular, the puborectalis muscle that goes from our pubic bone in the front. It loops deep into our body, so backwards into our body towards our tailbone, and it loops around the rectum, and it puts a kink in the rectum. So when our knees are at the same level as our hips, which is normally what happens when we sit on the toilet, or our knees are below the level of our hips, which is normally what happens when kiddos sit on the toilet and they're dangling there, especially, then that muscle is not relaxed. So it puts that kink in the rectum. We can't get as much out. It feels difficult to get it out. When kiddos are having their feet dangling off the toilet, their little bottom muscles are contracting to try and not fall in. So we look at potty posture first and foremost, and that's one of the best adjustments that we make right away, because sometimes they say, well, I just wasn't comfortable. And parents go, I didn't know that. And they say, well, you didn't ask, which is always such a funny conversation to witness, whether it's virtually or in the office, because they're like, oh, you're right. I didn't ask that specific question. I
But
asked, yeah,
this is the thing, right? Because your child doesn't know they just got here. They didn't know that they're not supposed to be uncomfortable on the potty. Nobody said.
right. Right. It's like, well, why didn't you tell me? And exactly it. Well,
Yeah.
nobody asked. I thought this is just the way it is. I thought I just have to struggle to stay up out of the toilet. And if you have ever, had the awful experience of sitting on a toilet where you thought there was a toilet seat and there turned out there was no toilet seat, that is, yes, I have done that too. That is what kiddos feel like when they are sitting on the toilet. They feel like they're going to fall in, or some kiddos just slide a little bit into the toilet and they adapt. They adapt to it, which is very interesting to hear their experiences. So when you put them in the right position, they can get more poop out on the toilet. They can have a better experience. They can relax a little bit, and it won't take them as long to get poop out on the toilet. And if you are under 6'2", you should be using a potty stool. You should be elevating your knees unless you have a very low old toilet. Now our toilets are like thrones. It's ridiculous.
Yes,
If
I
you,
have
yeah,
noticed this. They're getting taller.
they are getting taller because people are, for whatever reason, thinking that a taller toilet, oh, it is easier to get off of and onto. It absolutely is, but it is not beneficial for our body biomechanics. So if you have a toilet that is older, it is much lower to the ground, it has a much smaller seat. Those are beneficial for kiddos. You won't have to adapt it as much, and more beneficial for your own body. And you probably won't have to adapt it as much, but most people should be using a footstool when they're pooping.
That is
Yep.
fascinating. Even the grown-ups.
Even the grown-ups,
Yeah.
even the grown-ups. It's one of my favorite housewarming gifts to give is a squatty potty. Uh, pretty terrible, but yes, it's a fantastic thing. And you don't have to get a special stool. You can use one that you have around the house. If we still had phone books around, this is the only good purpose for phone books now, is to elevate your feet on each side and make your own little
Yeah.
footstool.
So position matters. Okay, great. And then I imagine there are some releases, stretches, non-toileting kinds of things that happen also.
Yeah, there are. And most of the time, kiddos' pelvic floors are tight. They are not weak. They don't need Kegels. They don't need to contract. They are tight. It's normally only when you get to like my higher level gymnasts or runners, those pelvic floors need to be strengthened a little bit because they are having higher impact on them and their body is putting too much pressure on the pelvic floor. Most kiddos, though, their pelvic floor is too tight because if you think of it, if they are consciously or subconsciously holding in this poop or even the pee or trying to prevent an accident from happening, their pelvic floor down and contracting and just shortening, shortening, shortening. So what we need to do, a deep frog squat is one of the best things that they can do. And it's a position that most kiddos play in naturally, but that is a wonderful stretch to help to open up the pelvic floor and stretch it. So you can do that right before a potty sit. You can do that throughout the day. I love that one.
I'm
But
also imagining that deep frog stretch is not awful for mommies too.
oh, it's wonderful for mommies and daddies. It is great. In the summer, I garden in that position. And so in the winter, I'm a little bit tighter because I don't do that as much, right? So it's great for everyone. And most people that are sitting during their workday cannot maintain that position without their heels coming off the ground. So heels should be flat. Kiddos are beautiful at this because they're still pretty stretchy. They're not sitting all day long. But most adults will need to hold on to the side of a sofa or a door. They'll have to hold on to something, but do this with their kiddos. It's really great. It's also great for birth prep too. So for mommies who are expecting, it's a good position for that too. But they need to stretch out those muscles to fully relax and let everything out on the toilet.
Yep.
Right. And that analogy too, where they don't know that they're contracting, that's when we engage those pelvic floor coordination exercises. So that's when I help parents and say, okay, we've released all of this stool burden. They're going every day. They're getting a good bowel movement every single time. We're still just not coordinating those movements beautifully. Maybe they are a little bit older and can't quite get to the bathroom fast enough. Then we engage some contractions and tell them how to contract, walk to the bathroom, and then void. So to prevent leakage, which is one of the reasons that we do that for a little bit older kiddos, because 4 and 5-year-olds can't really do that.
So much more to discuss, but
so much.
Parents will have gotten, I know, so much help just even from listening to this. If people want to find out more about you, how do they do that?
I'm on Instagram. I started The Incontinent Child on Instagram about 1.5 years ago. There's a link to a mini course that I do on there. So it goes a deep dive, but it's less than an hour, which is nice. Deep dive into all this information and what they can do to start figuring out what's happening. You can also find me on my website, kcgpediatricpt.com. And they can always reach out. You can schedule directly from there. If parents have questions, I'm happy to engage.
And we will link to all of that in the show notes. In the meantime, Kiley Gibbs, thank you so much for coming today.
My pleasure. Thanks for having me.